Well, hello guys. Today we have an article on the city's first Latina health commissioner who has she got the ambition to become a doctor when she went with one of her parents to a doctor, and the doctor said, for a swollen knee, the doctor said, I don't take Medicaid, but you can just put ice on that. Since then, she's wanted to become a doctor herself to see how she can even the playing field for people of all ethnic peoples getting their right to health care. Let's take a look at this article right now. Clinician to commissioner. Here she is. New York City Health Commissioner Dr. Osiris Barbot assumed her new post last month. Dr. Osiris Barbot knows what it's like to be denied care when you don't have the right kind of health insurance. Barbot was just a youngster when her mother took her to see a pediatric orthopedic surgeon to treat an injured, swollen knee. Quote, I remember distinctly standing in the waiting room, having the doctor come out and saying, I don't take Medicaid, but you can put ice on that, said Barbot, 53, who took over as the New York City's health commissioner last month. These kinds of experiences, especially at a very early age, stick with someone. Narrowing the health disparities that exist among communities and ethnic groups is one of Barbot's passions as she takes the job she has been preparing for her whole life. Born at Bellevue Hospital, Barbot is the first Latina to head the city's health department. She lived in the Patterson houses in the Bronx before moving with her mother to northern New Jersey. Quote, I like to refer to myself as a New Yorican, said Barbot, referring to a term of pride used by New Yorkers with deep Puerto Rican roots. I have sort of this bicultural experience. I think having a foot in both those worlds really informed my outlook on what it means to have a healthy community. The city has spent years tackling the health disparities among New Yorkers. Despite improvements, they remain stark. For example, recent health department statistics show life expectancy for people who live on the Upper East Side is nearly 11 years longer than for people who live in Brownsville, 85.9 years compared to 75.1 years. City Commissioner Mark Levine, chair of the Health Committee, said the high rate of tuberculosis, rise of e-cigarettes use among teens, and large amounts of added sugar in fast foods menus are also important to address. Barbot graduated from Yale University and the University of Medicine and Dentistry of New Jersey. One of her formative jobs was working as a pediatrician at a community health center in Washington, D.C. Quote, I've always dedicated myself to putting my Ivy League education to use in the community that needed it the most, she said. Dr. Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health and Health Policy, said, Barbot brings more than impressive educational credentials. Quote, her life is a testament to someone who has walked the walk, said El-Mohandes. There are certain skills and insights that you build through your life story that are just as important, if not more important, to the understanding of health challenges today. Her time at the health center put Barbot on the track from clinician to commissioner. Many of the health conditions she treated, asthma and elevated lead levels in children, were the result of inadequate housing, lack of health insurance, and other factors. Quote, I got frustrated of seeing this revolving door I had no real power or influence over, she said. Barbot returned to New York in 2003 to serve as medical director at the Office of School Health at the city's Health and Education Department. But a chance to run Baltimore's health department led to her charm city in 2010. She launched a Healthy Baltimore initiative and oversaw a dramatic drop in the infant mortality rate. In 2014, she came back to New York City Health Department for a first deputy commissioner post. Barbot was tapped to take over the top job by Mayor Bill de Blasio after Dr. Mary Bassett stepped down. She credited First Lady Charlene McCrae's strong commitment to mental health. And Barbot's own personal admission of struggling to deal with her father's suicide as a child has led to an outpouring of support from New Yorkers. She follows a health regimen that includes exercise and healthy eating, but admits to easing a sweet tooth with dark chocolate on occasion. Barbot also meditates every day, something she thinks is beneficial for everyone. Quote, we have to give ourselves, as adults, a time out, she said. So here she is, Dr. Osiris Barbot, assumed her new post last month. Barbot, right, administers a flu shot in October 2018. So here's Dr. Osiris Barbot. That's the first Latina health chief. Okay, thanks, guys. See you next time. Take care.